So let's evaluate your next letter. So this is fine. There is fine. There, sir, madam is fine. Joshua, this is also fine. Again, there is no need to mention the name of the mother or the father if the patient is a younger boy or a girl or a child, whatever. Okay, it's completely wrong to write this way. Okay, otherwise things are fine. So this information should be avoided. Okay, first thing. Now let's move forward. I'm writing to urgently refer Joshua who has signs and symptoms of constipation and dehydration. Your further assessment and management, including rehydration, would be highly appreciated. Purpose is fine, no problem with the purpose. But see, you're writing it urgently. So just because constipation and dehydration, it's fine, but you can mention that there is a severe constipation because see, the patient has been constipated for so many days and now it's been 5 6 days he has not even passed a stool. Okay, and he's dehydrated, and so this that shows more urgency, right? But overall this is fine. On today's visit, Joshua was presented by his parents and complained that he was refusing feeds, vomiting, and he has, again, was and has is not gonna be there in a single paragraph. Okay, and he had also not passed his stools since 5 days. His examination revealed irritability, dehydration, and dry mucous membranes. Apart from this, his weight was 4.1 kilogram, and there was mild generalized tenderness on abdominal palpation. Fine, no problem. On this date, Joshua was brought by his mother for his 6 week routine checkup, and she explained that he had not again has, it should be had, because you're writing the past visit, so it should be written in the past tense. Only one bowel action after every 3 days, and his stools were hard while he was feeding on demand and was making wet nappies. It's little complex way to write your information this way, but still I'll take it, no problem. As long as you're managing, somehow it is making sense, although it's not a very good sentence to write, but still it's fine. On examination, his weight was confirmed to be 3.9 kilogram, and the rest of the examinations were unremarkable. Rest of the it could not be examinations, just write examination, and it could be was. On assessment, there was only mild constipation. Therefore, his mother was reassured that these bowel habits settled with the time. Joshua's mother was advised to express milk and give it in a bottle with some water, 1 feed per day. Fine. Not very good, but fine. You'll be able to pass, and obviously it's just our second or third letter, so it's fine, no problem. On subsequent review visit, Joshua was presented again by his mother because he was crying and pulling his legs up to the chest, and has again, it can't be had if you're starting with the was. Had disturbed sleep throughout the night. His mother reported refused feed. Reported refusing so you can write his mother reported he was refusing feed. However, his weight again had increased. That's it. You don't need to write on examination. Okay, so you can skip this much. Consequently, Joshua was prescribed a trial of coloxal drops, and his mother was advised to give 2 feeds per day in a cup, along with a review within 2 months was requested. Uh, Joshua is just a 6 week old, so he can't take feed in a with a cup, right? So that is wrong information. Okay, so you can just simply skip this information, feeds per day, and that's it, along with the review. See, now it makes sense. Along with the review within 2 months was the request. In view of the above, I would be grateful if you could further assess Joshua's condition accordingly. I would prefer writing the delivery history, birth history, that he was born via normal vaginal delivery and there were no any complication. His birth weight was this and that. That information can be added. Okay. So that is important to mention here, because obviously it's a 6 week old baby who is having some complications. It's possible that because of this since he has since his birth, I mean, he is having constipation consistently, so it could be possible that the patient might be having Hirschsprung disease or something else. Okay, so you just have to write that information which could be related. Okay, but otherwise overall is fine, and it's faithfully is fine, and then you have to write, after faithfully you have to write the word doctor. Okay, DCTOR. This is important to write it down, otherwise your letter is not completed. Okay, so this is your letter. I hope you have understood whatever I've explained, and I hope next time you're gonna improve your letter so much. Okay, inshallah, I'll see you in the next letter. Thank you so much.